Hey you guys, Dr. Amy here with Fortress Physical Therapy. I have Bonnie who is going to be demonstrating some baseline movements that we tend to track with remote wellness programming or training. So I'm just going to take Bonnie through a couple movements based on the commands that she'll follow. So what I want you to do, this is also my mother as well, So I like to establish some baselines of how well the neck moves, how well the spine is able to bend back and bend forward, and just get a little bit of a balance assessment as all of this stuff or all of this movement provides me, the physical therapist, the ability to program that individual what they need within their wellness or training program. So, all right, Bonnie, I want you to go ahead and look as far as you can over your left shoulder. Good, and then let's check your right shoulder. So just based on that, she has some limitation to her left. Again, this is just data that we like to collect, and then as she progresses with her wellness or training program, this is something that we establish or reassess later on. Has it gotten better? Has it stayed the same, or has it gotten worse? All of this stuff we track from a physical therapy perspective. So, all right, Bonnie, go ahead and let's go ahead, make sure, yeah, just like that, cool. So what I want you to do is just kind of follow your fingertips and bend forward as far as you're able. So eyes on your fingertips, you just bend as far as you're capable. And I'm just looking for nice curvature in her back and her ability to weight shift. Good, come back up for me. All right, now I want you to put your hands on your hips and let's see how far she can bend backwards at her waist. Go as far as you can. So yeah, definitely a little bit limited there. She's got some weight shift forward, which is what I'm looking for. Again, these are just some baselines. Another good thing that I like to test too is just single leg balance. So if you need help, my hands are here, but I want you to try to, Bonnie, balance on one leg. Let's see how far we can go. Hold it. Try again. And this is her right leg. All right, let's see what the left leg gives us. Woo. All right. So normally, someone should be able to balance without support on one leg for 10 seconds. So we know, and based on this baseline assessment, that I would probably program some balance movements within Bonnie's wellness training, but movements that are safe for her and movements that make her feel safe and movements that she would feel confident in. So an example, I'm not going to make her do this, but an example might be getting on all fours and then perhaps maybe, lifting one arm, or she just might balance here in a tall kneeling position. So bringing her closer to the ground. But these are just some baselines that I like to track, and then we reassess that later on.